welcome everyone. It's nice to see you people here. Thank you for tuning in and our traditional live Q&A with Dr. Elena Klimenko. That's me. And for those of you who don't know me, I am a functional medicine physician in Manhattan, New York City, and I've been doing it since 2007. I can't believe it's going to be 20 years next year, which is a fun journey with lots of learning and lots of updates. I feel like I never stop learning because there's more and more new information coming in about the human health. Who would think that we're still learning a lot of new stuff? But today we're going to talk about andropause in men and how we can help them to reclaim their vitality. When I was thinking about the topic for live Q&A, of course, I was thinking, okay, what are the holidays we have in June? And of course, there's a Father's Day and men's health that we are underappreciate sometime in the functional medicine because honestly, majority of my patients are women. But lately, I noticed the trend that more and more men are taking charge of their health and they want to know more about what can they do to stay with optimal energy and great resilience and longevity. And so they are more and more men are becoming proactive about their health. And therefore, I'm dedicating this session today to our dearest men and their hormonal health and hormonal balance. Okay, so agenda for today will be to discuss what is andropause. And we're going to learn the real truth about andropause in men and what it is and how often it is missed after 40 years of age. What are the common symptoms of menopause and what are the root causes, including stress, insulin resistance, nutrients deficiencies, and environmental factors that are becoming more and more important. We're going to talk about practical functional medicine strategies, how we can restore hormonal balance and vitality for our dearest man. And we're going to talk a little bit more about what's new in our practice. So, did you know that most men have no idea that hormonal decline is quietly affecting their energy, mood, and vitality every single day? They kind of fed the stories, oh, it's just your age, get used to it, you're getting old, or you're not sleeping well, or all that stuff that a lot of our men are learned from either their friends or from their doctors. But it's really new concept because women in menopause kind of learned it from their parents. They learned from mothers. Oh, it's going to be a time in your life when your hormones are not going to be the same and you're going to go through the transition, and society recognizes it and medicine addresses it. And more we have other options for women. However, for men who experience andropause, the processes could be frequently very gradual and often silent until the hormones already made, the hormonal imbalance already made that metabolic change. And it's getting more and more difficult to reclaim the hormonal balance. So the testosterone declines really slowly and symptoms really snowball quietly. And most men never really connect the dots. Our patients do, but many men out there who are not exposed to functional medicine probably never even thought about it. So it is a silent epidemic, and most men have no idea it happens. Fatigue, low drive, mood change, often dismissed as just aging, but there is a root cause of it. And one of the most common presentation that I learned in functional medicine is that lower back pain in men in their 40s or 50s. And it's just like all of a sudden the lower back starts hurting them. And little by little, we start discovering that it is due to their andropause. And why does the lower back start hurting? Well, because as men drop their testosterone, the muscle strength is also reduced. The strength of their body reduces, and their muscles that connect the vertebra and hold in place, all those vertebrae and all those intricate structures in our spine becomes weaker and weaker, and suddenly it collapses, and men develop lower back pain. And then they can't exercise and then they start gaining weight and on and on and on. So also known as the late onset hypogonadism, or LOH, andropause is very gradual. It's age-related decline in testosterone and other androgens, other male hormones. And that's developing as slowly over years, not as rapidly as menopause in women. So the clinical definition of andropause involves progressive decline of not just testosterone, but other androgenic hormones like DHEA, which is a precursor for many hormones in our body, and other androgens. Those testosterone drops approximately 1% per year after the age of 30, leading to cumulative hormonal imbalance that affects energy, mood, most importantly, and metabolism. Because once the testosterone is going down, then all other things going in the wrong direction. So it begins, for some men, it begins pretty early in their 40s, early 30s and 40s, and it's becoming more and more younger, okay? Because the decline is gradual and subtle, most men remain undiagnosed for years and often dismissed as just getting older. And we actually know that statistically, testosterone levels aren't what they used to be. And you probably heard it in some of their articles that recent research showed that today young men, have a 10 to 20% lower testosterone level compared to the men of the same age even few decades ago. And with the level declining roughly 1% per year, understanding and supporting hormonal health for men becomes extremely, extremely important. So we do see this epidemic of younger men with a significantly lower testosterone than their father and grandfathers had in their age. And it actually translates in the behavioral manifestation. Some men are not that motivated. They're not actively looking for building the family. Maybe they don't even want to have a job. They sometimes prefer just to sit and play video games. And we see that. I hear it from my patients. Their children in their 20s, 30s, becoming less and less motivated. I don't know if it's a technology, if it's just general society, or is it competition? I really don't know. But we know that statistically, younger men have lower testosterone. I was attending one of the lectures at the medical conference related to functional medicine, and one of the doctors brought up this as a huge problem for the society because we're losing men in their traditional role of being their, breadwinners and go-getters and hunters, and we're talking about the old age, but it is shifting the society and roles in the society. But also leaving our men unmotivated, and younger boys unmotivated, less competitive, and this is not a pleasant trend, especially for parents. So this is something that we all observe, and here's more statistics that 40% of men ages 40 to 70, up to 40% of men over 45 have low total testosterone, and most walk around undiagnosed. 6 to 12% of men over 45 are symptomatic, only up to 12% asymptomatic. And rates rise sharply if men have some other chronic illnesses like obesity, diabetes, or chronic stress. So they're, men as vulnerable as anyone. So the common symptoms, of course, is their testosterone is that driving force that helps man to mate and find the sexual energy, right? Stamina. So when their libido goes down and men have fewer than morning erections or erectile difficulties or intercourse is not satisfactory, we always have to look at testosterone. They also lose energy and vitality. They have this persistent fatigue. They sleep and they still have fatigue in the morning, but most importantly, that loss of motivation, stamina, and assertiveness. Getting up in the morning, going to earn some bread, right, and make the living. So more common symptoms could be also the change in the body composition and mood. Body composition will change to the loss of muscle mass and increased belly fat, decreased exercise capacity. But most importantly, the testosterone is such an important hormone for our brain health, and especially for men. They get more irritable, more complaining, they have lower mood, they get brain fog, the poor concentration and focus. They're just not happy campers anymore, not as they used to be when their hormones were in their 30s, right? So multiple factors can drive andropause, and identifying the root cause for each particular patient is extremely important. So I just want you to get this understanding that there's sometimes it's very easy, it's one factor and that's it. But usually to restore the vitality and hormonal balance, we need to look at variety of the factors. So yes, aging hormones is true. Their testosterone does decline. Chronic stress will affect that hypothalamic pituitary adrenal axis and suppresses testosterone production and disrupts hormonal signaling. So higher stress, lower testosterone, right? And we live in a society of the stress proclamation. So metabolic factors, insulin resistance, accumulation more of that visceral fat, the fat that accumulated around the organs, will accelerate testosterone conversion to estrogen. And I routinely check my man for estrogen because testosterone under certain circumstances will move to estrogen and man will develop gynecomastia or man's boobs, what we call, right? And some men in their 50s and 60s will have a higher estrogen than women in their 50s and 60s when they're in menopause. So this shift is a real thing. Also, we're looking at the sex hormone binding globulin. When the sex hormone binding globulin, which is the protein that binds free testosterone, when that SHBG going higher, men lose their free testosterone floating in the blood and therefore reducing bioavailable levels. Also, some nutritional deficiencies, most commonly is zinc. And those of patients of mine who come to me, we routinely check your zinc level, either in their tasting, which is naturopathic test, tasting the zinc, which determines the functional level of zinc, or we will check your zinc in the bloodstream and most importantly, intracellular, where you have your reserve of zinc. Vitamin D, magnesium, all of those nutrients are extremely important for hormonal synthesis and hormonal balancing. But now we talk more and more about the toxic environment where we live. Those environmental xenobiotic or xenoestrogens, estrogens, actually the chemicals and the particles that will work like estrogens. So even if men have a normal testosterone level, but their estrogen from the plastics and toxins is high, that testosterone effect will be blunted and the disruption of endocrine system will happen. Excess of alcohol, poor sleep, sedentary lifestyle, all of those things compound hormonal decline over time. And then as a result, we see their symptoms of hormone testosterone deficiency and andropause. Modern men face a new threat, plastics. Okay, we now know the studies show that microplastics were found in 100% of human testicles of the samples that were tested. And the human sample contains nearly 3 times more of plastic than canine sample. Imagine, we feed our dogs probably better than we feed ourselves. And researchers are investigating potential effect on fertility and hormonal production, but I would suspect nothing good comes from it. And with the world that we live in, with the infertility being such a big factor, I think it has an effect. But also, don't forget their electronic devices. Your tech may be closer than it should be. EMF, electromagnetic field. We live with their 2, 3, 4 electronic devices in one room. Every room has a TV, and the majority of it is EMF, right? Of Wi-Fi connected. So we are bombarded by electromagnetic field. How many people you see wear their phone in their pockets, in the front pocket, right? Radiating the testicles. They're actually structures that produce testosterone with their electromagnetic field. And now being 5G on everybody's phone, we're basically just putting our testicles into the microwave. So EMF, definitely, we have research, and more emerging research suggests that prolonged exposure to EMF may negatively affect sperm quality and reproductive health, and prompting scientists to investigate potential impact on hormonal health as well. So keep those laptops off your laps. Keep the cell phones away from the testes, please. And for women, please don't carry the cell phones in the bra. You're radiating the breast, which is the tissue that is sensitive to electromagnetic radiation. So we definitely need to change those habits, even though it's so convenient to keep it right here in the pocket. So why does it matter? We know that andropause disrupts cellular energy production. So testosterone basically affects almost every cell in our body. So it affects how we build the muscles, how we make ATP, the energy molecules. And that's why men with low testosterone will have this fatigue and weight gain and slower metabolic function, affecting daily performance and long-term effect and health. Heart health and muscle strength, definitely we know that people who are stronger or people who have more muscle mass live longer, and as well as a good amount of muscles will provide a strong bone density. But when testosterone is low, men unfortunately won't have energy to exercise, and that will diminish their physical capacity over time. And therefore, it is a vicious cycle, right? And again, mood, mental clarity, quality of life, all of that declined with the low testosterone. But who suffers from it? Of course, man suffers from it, but also their partners are suffering from that. We suffer from that. So therefore, we need to take care of our men and remind them to have their testosterone check. And how do we check testosterone? The accurate lab testing is really essential to confirm their baseline of testosterone when man is still younger and in their prime, in their 30s, and then check it periodically, especially if the symptoms start appearing. So the core labs is not just total testosterone, but also free testosterone and sex hormone binding globulin. And of course, very important to check if testosterone is not converted to estradiol. Also, there are precursors of this testosterone, LH and FSH, the hormones that are produced in our brain, in the pituitary gland, and stimulate our testes and adrenals to produce testosterone. Some other labs that I always like to include is DHEA, because DHEA sulfate specifically is the precursor of the testosterone. Don't forget about thyroid panel. That includes not just TSH, but at least TSH and free T3 and free T4, and cortisol. And not just morning cortisol. I like to look at the whole cortisol 4 times, 4 samples in a day, so we can see the physiological curve of cortisol that's supposed to be high in the morning and then winding down at night, so when you can sleep peacefully. So, and the key tip that I always communicate to my patients, please make sure you go to check your testosterone first thing in the morning. Early is better, 7 o'clock up to 10 o'clock in the morning, you have to check your testosterone, and it has to be fasting blood test. That's what the consistency of testing testosterone in that way will give us a better picture and understanding. And I do encourage my younger gentlemen, patients, to test their testosterone at the baseline. Where are they now in their 30s? And trust me, I see so much of the low testosterone in my younger man patients. So what can we do? We're gonna, first of all, if we notice that testosterone is out of balance, first we need to look at the metabolic health, what they eat, how their insulin sensitivity, what is their fasting insulin, how's their visceral fat. We'll do the body composition analysis to see what is the percentage of body fat. We're looking at their balancing sugar level. I encourage all my patients with metabolic issues to wear the continuous glucose monitoring. It's so easy now. You don't even have to stick your finger anymore. You just put that little disc on your arm and you observe your glucose level throughout the day with a smartphone. So restoring that healthy body composition is the key. It's easier said than done, but this is the work that needs to happen because this is essential. Even if we need to go and replenish testosterone for our elder man, we need to make sure that testosterone lays on the healthy environment, on the healthy body. So support stress and resilience. Make sure we're supporting cortisol and healthy cortisol production and metabolism. We correct all nutritional deficiencies. Remember zinc, magnesium, and vitamin D. We must reduce chronic inflammation because men with the chronic inflammatory markers will move testosterone in the wrong direction, and testosterone might do the wrong things. And of course, address lifestyle root causes. Make sure they sleep. Make sure they drink enough water. Make sure they exercise. All very, very important factors. So it's not just smearing their testosterone on your skin. It also work on those foundations of the lifestyle. So resistance training, regular movement to boost testosterone naturally and maintain lean muscle mass. That changes so much. And I actually just recently joined a very interesting workout routine where I lift very heavy weights, very, very slowly, but once a week. And I see significant improvement in my strength and in my body composition. So my muscle percentage of body muscle mass is growing. And literally, I spend half an hour working out with the weights. That's it. The rest of the time, I can do whatever I want. I can swim, I can go for a walk, I can do yoga, I can do nothing. But that half an hour once a week of resistance training that is done in the right way should be done because that's a huge game changer. Quality sleep, non-negotiable, okay? Essential for testosterone production, for all our hormones regulation, cortisol, as well as brain health, stress management, and reducing alcohol and processed food to lower cortisol and support hormonal balance. Don't forget detoxification. We are all exposed to toxic substances in our environment, especially if we are in the urban area. It's in our air, it's in our water, it's in our food supply. Even if we try to eat extremely clean, it's unfortunately inevitable. So please make sure you don't forget your detoxification. So what do we do to support healthy testosterone production and metabolism? First of all, nutrients. Zinc, essential cofactor for testosterone synthesis, number one nutrient for men. If you want to get a gift to your male friend, give them a bottle of zinc, and they will be you'll make a huge difference in their health. Vitamin D3, remember it's pro hormones. and it directly supports androgen levels. Boron is a mineral that does not get a lot of recognition, but it does a very important function. It actually reduces the sex hormone binding globulin, that binding protein that binds testosterone, and makes it free and available to work on the cellular membrane. We also need to support our cortisol, because remember, high cortisol, suppression of the cortisol, testosterone. So magnesium reduces cortisol and improves sleep quality. So all of us, especially who are stressed, need to take magnesium at night to improve not only sleep, but also insulin sensitivity. Herbs like ashwagandha and rhodiola, that adaptogenic herbs that buffer chronic stress and restore adrenal resilience. Do you have to take them all the time? No, but it's nice to take them periodically. Also, don't forget some nutrients that will support conversion of or protect the conversion of testosterone to estrogen or to other hormones that might not be as beneficial for us, like DHT that causes the baldness. So those are the targeted botanicals such as dim, chrysin, or stinging nettle root help reduce excess estrogen conversion and improve hormonal balance again. So now we also can use testosterone support therapy. For example, we can use testosterone receptor sensitizers as an herbal products. Herbs like Tankaya Lee or Tribulus or Korean ginseng, all considered to be male tonics. And there's a really good compelling studies that show that men in their 60s and 70s, when they take Korean ginseng, all the parameters improve. And it's a beautiful herb that has this synergistic effect and affects not only cortisol and testosterone, but the whole network of other reactions. And don't forget photobiomodulation. We talk more and more about healing properties of light. We know that the red light therapy supports mitochondrial function, reduces inflammation, and may help stimulate natural testosterone production. A personalized supplement protocol should be tailored to each individual lab results, clinical presentation, and health goals. So as you probably know, we're now offering the photobiomodulation therapy in our practice, where we deliver the red light directly into the bloodstream. Great effect to support mitochondrial function, reduce inflammation, stimulate natural testosterone with the red light, but also blue light, support circulation. We now have studies that show that blue light can actually increase nitric oxide production, and it's that key nutrient that was a target for medication that improve their peripheral circulation and improve the erection and engorgement, penile engorgement in case of erection. So blue light therapy will improve their peripheral circulation, increase the nitric oxide. It also will make your endothelial cells that are coating the lining of the arteries, live longer. We have now studies that blue light has anti-aging properties. And of course, yellow light is also supports serotonin production, improves the sleeps, promote the vitamin D synthesis right in your bloodstream, as well as lymphatic drainage, detoxification. And people usually feel very calm when they get their either blue light or yellow light, because it promotes that relaxation and healthy cellular function. Red light usually invigorates people right away. They feel almost like high on red light, but blue light is really relaxing and yellow light are relaxing. And I actually see the blood pressure going down on the blue light and yellow light therapy. So phenomenal. There's a wisdom that we all heard. The water, sunlight, and the clean air are the main healing powers for us. And now we have their light as the photobiomodulation. So you'll hear more and more about photobiomodulation because it's fabulous option, therapeutic modality. So when we address all those factors that we just discussed, and it's still not enough. Sometimes we need to look at the testosterone replacement therapy or TRT. It is never a first line option, and it should be considered only after the root causes are addressed. So we need to monitor closely with their practitioner how to prescribe it and what to prescribe, because we have, before even giving people testosterone, we can give something that can stimulate your own testosterone production. It is a pharmaceutical, but it has to be prescribed by a knowledgeable practitioner. And then if that doesn't work, then we can go for the testosterone replacement therapy. It should be judicious and it should be monitored properly, because even the too much of a good substance can be harmful. So the potential benefits, and what we hear from people who are on testosterone replacement therapy, they report improved energy, vitality, improved the libido, sexual function, increase the muscle mass and strength, much easier to build the muscles, improve mood and cognitive function, and better bone density and body composition. So it could be beneficial for appropriate candidates, especially when the testosterone level is low, and when optimizing lifestyle and reducing environmental exposure and toxicity is not enough. So we can definitely look at the hormone replacement therapy with bioidentical testosterone that is similar to your own testosterone in the body. So it does give us a lot of hope. It does give us a longevity and resilience, and many men can achieve that with to restore natural energy and stamina and improve body composition by taking care of the lifestyle and the risk factors that we can identify in our session together. So, and that will help men to maintain their longevity and maintain their participation in their life of society. So, but the first step is very important, understanding that andropause does exist, and we're recognizing it, and we can test it. And earlier we start testing testosterone in our men, earlier we can help them to continue to be a great support of the society and live full life. So taking the next step towards restoring your energy and strength and well-being, and the answers you need within your reach, speak with your practitioner, ask the practitioner to do the proper workup to investigate your testosterone and see if you need additional support. So I'm really happy that we have several men here today, and I would like to offer some bundle for our men, which is this advanced detox liver and GI support product that I really love, and I take it at least once a week myself, and because we all need to detoxify, as well as magnesium that can help men to relax at night, and detox pearls. So especially for people who have detoxification pathway issues and they cannot move the toxins out of the body easily, this is a great way to support the detoxification process, boost the energy, enhance the recovery from demanding day, and as well as that from exercises, and just support overall male vitality. This is the powerful trio that will help you to get to your optimal health and achieve and restore your daily energy. So you can order that from our e-store that you can reach through my website, or just go to shop.drelenaKlimenko.com. And as a thank you for your participation, please use this code to get a 10% off through the whole site on my website. So, and if you're ready to act and you're still not my patient, please call the office, schedule the discovery call with my team. But if you are my patient and you're interested to investigate your testosterone, please schedule an appointment so we can start the workup for you. Okay. And then I just want to remind you that I now have a location in Florida. So I'm in Manhattan and in sunny Miami, which is the northern Miami, Sunny Isles. And I go there periodically. So my next day there will be in June 31st. So please, If you have any friends, or if you are in Florida and you're watching this video and you want to schedule an appointment, please make a phone call and we can probably accommodate you.